And welcome to another episode of our podcast. My name is David Levine, founder and CEO of ResTech Solutions. And today's topic is Rethinking Healthcare in 2025, a fresh approach to the challenges with patient care. And today joining us, I have Erin. So Erin, I'd like to welcome you. Thank you for coming.
Thank you. Thank you for having me. Erin Vandermoor. I'm originally from Chicago, so I talk a little fast. Don't mind me. I'm a licensed mental health therapist for about 15 years now. And I've worked in many different fields from school to hospitals to private practice. And now I am a CEO of my own private practice and I have a mental health app, Mind Circuit. And then because of Hurricane Helene here in Asheville, I started a non-for-profit trying to help fellow therapists who have been doing pro bono sessions.
All right. Well, fantastic. I look forward to hearing more. And again, thank you for joining us. So let's just jump right in with our first question related to today's topic. So I know your work, and as you mentioned, bridges, mental health, education, and even technology. So how do you see technology playing a role in improving trauma-informed care and accessibility to mental health tools in 2025 and beyond?
Well, I think we should embrace it, honestly. It can help us a great deal. For example, virtual sessions. Before COVID, it was a nightmare to get virtual sessions approved by an insurance company. We had the technology, but for whatever reason, we weren't utilizing it or it wasn't approved by insurance companies. But then during COVID, it became a necessity, and now we use it constantly, and it has allowed a great deal more of individuals who maybe don't have access to transportation or maybe they live in very rural areas, so they don't have access to clinics and other healthcare professionals, that access that they didn't have before. And that's just one example of many of showing how technology can better things for us and not to fight it, but to figure out ways how to, I guess, like negotiate and figure out ethically, how can we do this? What fits people? Where are some of the technicalities we may need to think of? But I wouldn't go up against something and just say, nah, let's not do it. That makes no sense to my brain and it's not helpful.
I appreciate that vantage point because I've talked with many people and I kind of hear both sides of the coin. And with the direction in general that society goes, we can't afford to ignore the technology, regardless of whether it's in healthcare or some other industry. So I really do appreciate that because I think it is critical, and it is almost hard to function today without some piece of technology assisting us in some way.
Absolutely. I mean, our phones are now computers. I mean, I'm old enough to remember when I had a landline and a cell phone wasn't a thing. And then all of a sudden it was a thing for people with money. And now everybody has one, including children. So technology moves fast and it moves with or without you. And so I would rather move with it and make it a benefit to my patients and then also be able to have influence over it so that ethically there are standards that are in place for people. For example, AI. I think AI is a wonderful tool, but it is a tool and we can decide how to use it or not. It's certainly not going to replace a therapist. And so anybody who's nervous about that, I would push back and say that's not where we should be concerned about. Let's look at the ethics and see how we can use it to our advantage.
I would agree there. So I want to transition a little bit now and talk a bit more about your business side. So to start out, can you tell us a little bit more about Helene Therapy Network and the mission behind the work that you're doing there?
So during COVID, a lot of us fellow mental health therapists, social workers, counselors, different types of healers, because of COVID, we had to pivot and learn how to not only use technology, but we also had to, unfortunately, give out a lot of pro bono sessions. And we are not allowed to claim that on our taxes. So we just eat that cost. And there's nothing we can do about it. And when Hurricane Helene hit Western North Carolina, I started to hear the same similar things that I heard during COVID times. Other therapists reaching out to other therapists to see who had open slots for free therapy or reduced. And I was just worried that we were going to lose a lot of good clinicians because during COVID, lost a lot of good clinicians. They financially just could not keep up with the amount of work out there and the amount that was not paid. And so I started hearing some of that again within my community. So I started a non-for-profit to help cover some of the cost for those clinicians. Some of the backstory is when you're in mental health, there are a lot of low cost, free therapy for like specific companies and specific agencies. And generally they're community health based, which is fine and all. But if you have been working with a therapist and you have rapport and you're established with them, to certainly be told that you can't see the therapist that you feel safe with, and the only way to get therapy is to go to this local community center where you have no rapport, generally most people just stop therapy and they don't continue the care that they need. And so there's this disconnect, realizing that those in private practice who provide pro bono or sliding scale also have a benefit to the community, and they get overlooked. They get overlooked with grants, with funding. They're just constantly overlooked. This whole idea of if you're in the healing or the caring field that you should be broke, it just drives me batty. I don't know how they expect clinicians to show up as their best selves if they're worried about making their own rent. It makes no sense in my brain. So I started a non-for-profit to try and help clinicians be able to get paid an actual living wage who are in private practice, so that the individuals here in North Carolina who are actually in therapy and have made that step don't lose access to the therapist that they're close with and they've established rapport and safety. So that's what I'm trying to do slowly.
All right. Well, no, I appreciate that. It's definitely a much needed deal. I've talked to a lot of people, as I mentioned, and hearing the different stories of what others are doing in the space. I think I think this can be huge.
No, I don't know where the non-for-profit is going to go and how long I'll be able to fund it. Grants are very difficult these days. And the fact that I want to pay therapists a living wage doesn't seem to be super popular. But if anything, at least I'm getting the conversation out there about the value of clinicians and that we need to start having conversations around that they do have value and worth and therefore should have a living wage.
I agree. All right. So you've also founded Mind Circuit, which blends neuroscience and education. So what inspired the development of that platform, and how are schools responding to this approach?
Well, apparently I don't ever like to sleep because I'm always doing something. I started that actually during COVID. I was trying to figure out a way to help past clients. They were contacting me. They didn't necessarily want therapy, but they wanted a podcast or an app or a book that I could recommend that would help them and calm their nervous system, which is something I specialize in as a trauma therapist. I work in EMDR, which is based on how your nervous system can heal itself and desensitize from tough things. And so they reached out to me and I started looking. I didn't see a lot of good options that were actually things made by those in the field with the background in the field. There's a lot of great apps out there and self-help books and podcasts, but there's not a lot by actual clinicians. So I decided I was going to step into the realm, and I started working on an app that helps calm the nervous system the same way that EMDR, evidence-based type of therapy, does, which I don't know if your listeners know anything about it, so I don't want to be too technical, but think about it like a stubbed toe. You stub your toe and it hurts like heck in the moment, right? But the next day, you can't feel that pain. You have the memory of it being painful, but you can't actually feel the pain. And that's what the brain and the body does during REM sleep to allow you to process everything from that day, desensitize and move forward so that, we're not all still stuck in our beds after our first crush broke our hearts, right? We're able to move forward. And so my app is based on that, the idea that you can have these micro healing moments where you can calm your nervous system and take a pause and take a breath and reset. So I wanted to make it more accessible to just everybody. especially within the school system because I used to work in schools.
And for those who might be interested, can you share what that app is? So if someone wants to go check it out.
It's called Mind Circuit, so it's getting the mind and the circuits in the mind to rewire, work together to heal. So Mind Circuit, I have a website, I have an app, and I'm developing curriculum right now for schools. I'm presenting back home in Chicago to my fellow school counselors in about a month on the curriculum and how to use it as little like micro resets throughout the day. Because if a kiddo comes in and they're all, wound up or hungry or angry or upset, they're not ready to learn. And so what can we do quick as an intervention that's based in neuroscience that'll calm the nervous system and tell the nervous system it's safe so that the kid can actually get to that higher level of thinking and be able to learn and not be stuck in that survival mode.
All right. No, that's pretty awesome. It's great to hear that we got some phenomenal resources out there for people that can definitely be of benefit to them. So I do appreciate that you have taken the time and the effort to put that out there for folks.
Thank you. Again, technology should be used as a tool to help us. And so, having an app, my app uses AI for affirmations, finding different ways to use technology in positive ways to help us as a race, it just makes sense to me.
All right. Well, perfect. And so, as your initiatives expand, what challenges have you faced in managing or protecting sensitive data, especially when working with children's or school based information, if applicable at this point?
Well, there's always the process of going through a school board, having whatever app or curriculum that you're using showing where it's storing data, what it's storing, how to protect everybody ethically. I just always, as a mental health therapist, think of HIPAA. So I'm already always thinking about privacy and how to protect people's information. Because when you work with a public school, it's not like you can just download any app to your computer. There's additional securities and steps and safeguards that an app has to pass. So that's been a learning curve and a hurdle for me. I've never learned so much about technology in my life as a mental health therapist. It was not exactly what I thought I would be doing when I got my master's in it. But I do enjoy the challenge. As I grow, I think it's just also balancing everything, figuring out what's a priority and deserves my attention and what I should delegate to someone else. And that's always a difficulty when you're a startup and you're the main person.
No, I can definitely understand that. There are many days I still feel very much in that phase as well. So I can appreciate everything you're working through. So transitioning to a little bit more about yourself, what part of your work brings you the most fulfillment, whether that's creating the new tools, maybe working directly with children, or even seeing schools embrace the trauma informed practices?
I would say it's just those little moments with individuals where I see them kind of have that aha moment where something clicks, where something feels better, where they realize that they can feel better about something, they can start to heal. That just it brings so much to me, such joy and just satisfaction, because I never know the ripple effect. I never know what that person's going to then go out and do that's really cool for someone else. And it's just kind of cool thinking about that. I also enjoy being able to be creative as a therapist. A lot of my work was very individualized or group, but always confidential. Being able to have an app, to have a non for profit, to have a company, I'm able to be more visible, more social, more creative, and have interesting conversations like we are right now. So I've enjoyed that process.
All right, well, perfect. And as we kind of approach the end of our session here and wrapping up, I do want to take some time and ask about any current initiatives you may have going on. So, are there any new programs or collaborations you're excited about right now, especially the ones that might involve technology or remote access for mental health services?
Well, I'm really excited. I'm writing a book in the curriculum, and that's going to go along with my app so that there's more access. I'm going to be presenting that at the Illinois School Counseling Association coming up shortly. And then when my book, Wired to Heal, is published in a couple months, I'm then going to do professional development with some different school districts around how to use my app, bilateral stimulation, these little micro healing moments to help calm a nervous system in a kiddo so that they can be more in tune in school. So I'm excited about that.
That sounds fantastic. So hopefully all that goes well, and I do
No,
wish
thank you.
you a lot of success with those endeavors.
Thank you. I appreciate it.
Oh, you're welcome. So as we are wrapping up, are there any final thoughts or anything you'd like to leave the audience with?
I would just say to recognize that technology can very much be used for the positive. And so if we keep approaching it that way, we will find positive, healthy ways to use technology. And also that mental health and your physical health is intertwined. It should not be treated any differently. So if you go to a dentist a couple times during the year, please go see a mental health therapist a couple times a year. It should be no different.
All right. Well, Erin, I do appreciate you taking the time and want to thank you for coming on today.
Thank you. I appreciate it. I enjoy conversations like this.
All right, well, you're welcome. And for those who are watching, if you like more information, check the description box below this video for all the contact information. All right. And again, thank you, Erin.
Thank you.